Good morning. We are speaking on the traditional territory of Treaty 8, and I also want to acknowledge the Métis people who share a deep connection with this land. Good morning, everyone. Thank you so much for joining us. My name is Leanna Paiva, and I am the Alberta NDP candidate for Peace River. And I am joined today by Alberta NDP leader, Rachel Notley. I am so glad to have Rachel here in the region. We had a fantastic event last night, talking to the supporters about the hopes for a better future. They told us about the urgent need for better health care. They said that they need more action to address the cost of living and the real plan to create good-paying jobs here in the Peace region, both for now and the generations to come. I have also heard specifically about the challenges facing education in the region, and as a junior high teacher in the Peace River and a mother that is so near and dear to my heart, I know that an Alberta NDP government, led by Rachel, will take immediate action to support our schools and our hospitals and our clinics. And I also know that the past promises by the UCP of a public health guarantee weren't worth the cardboard that they were printed on. Albertans deserve better. The people of Peace River deserve better. And the people right here in Grande Prairie deserve better. And it is with all of that in mind that I am so pleased to turn things over to Rachel Notley.
Well, thank you so much, Leanna. That was great. And I have to say, I'm very excited about the energy that you are bringing to your campaign in Peace River. And I'm excited for what the future holds for the Peace region as a whole. And really, I think a better future like the one Leanne and I are working to build starts with how we take care of each other. Public health care continues to be in crisis throughout the province. And it has been that way for the vast majority of the UCP's time in office. Last night, we spoke directly with frontline healthcare workers who told us the Grande Prairie Regional Hospital is consistently and constantly at or near capacity. Worker burnout continues to be a real challenge. Morale is low, and resources just aren't there for frontline healthcare. Danielle Smith believes that by repeatedly claiming the healthcare crisis is over, she will convince Albertans that it is. But the real stories that we hear on the ground are very, very different, and they're also what Albertans themselves are experiencing. Months-long delays for urgent surgeries, frequent closures of rural healthcare facilities with little or no notice, workers leaving their healthcare profession of choice or leaving the province altogether in search of a place where they feel better supported and better respected in the critical work that they do. The emergency department in Beaver Lodge was without a physician more than a dozen times in 2022 and has already had the same situation occur several times this year. And when it closes, all EMS calls are rerouted to the Grande Prairie Regional Hospital, adding far greater stress to the staff there. Fact is, we need a plan, not cardboard promises. And that's what we got this week when Danielle Smith spent her time pointing to a piece of cardboard as some sort of sign of her commitment to public health care. Thing is, we've all seen that move before. Frontline healthcare workers still remember that Jason Kenney also pledged to support public health care with a cardboard platform. And then 6 months into office, he started talking about firing nurses, delisting healthcare services, and then, of course, they ripped up the deal with doctors. And all of those changes spurred widespread chaos, and the government actually never even let up on that, even as a global pandemic imposed unprecedented pressure on hospitals and frontline healthcare providers. So flash forward 4 years, and there's Danielle Smith trotting out the same old tired guarantee. But this time, we know better. Not only do we have the UCP's record to look at, we also have Danielle Smith's own words to hold her accountable to, wherein, less than 2 years ago, she openly advocated repeatedly for forcing Albertans to pay out of pocket to visit their doctor and to pay a deductible should they need surgery in the hospital. Albertans know that's just wrong. And so I ask them to consider who it is they can trust to provide better public health care free of charge. My record and my position hasn't changed in the last 2 years. It hasn't changed, actually, in the last 2 decades. We don't need cardboard signs. We need action, real substantive action to support public health care, to end the crisis, and to deliver better health care for you and the ones you love. And that's why Alberta's NDP has introduced a plan to deliver quality public health care, including timely access to a doctor for 1 million more Albertans. We'll introduce what we're calling family health teams, a reimagining of primary care, a system where several health professionals work together in clinics that provide a one-stop shop for families and their healthcare needs. And while Danielle Smith and the UCP dabble in new ways to make you pay to see a family doctor, what we'll do is work on better supporting those doctors with more allied health professionals to assist them in the critical work they do to keep you and your family healthy. And we will ensure that the health care Albertans receive is never, ever, ever dependent on the amount of money that those Albertans have in their bank account. That's my guarantee, and I say, judge me on my record. My promise to you is I will do everything in my power to ensure healthcare is there for you when you need it and where you need it. Now, I'd also like to talk about public education just for a moment, something that I know is so very near and dear to Leanna and, of course, to so many other parents here across the Peace region. I know full well that repeated UCP cuts have left our schools thousands of teachers short. The government fired tens of thousands of educational assistants via a tweet at the outset of the pandemic, and most were never rehired. So my commitment is to reverse those cuts in a very substantial way. Now, we will be rolling out the details of our education platform very soon, but know that it will include a major reinvestment in our classrooms, in our future. The students learning right here in Grande Prairie, in Peace River, and across Alberta are the future, and we will support them as such. Now, I also know that Grande Prairie itself has seen massive growth in recent years, and the UCP has failed to build schools here where we need them. The previous Alberta NDP government had a proven track record on this. We built and modernized more than 240 school projects. So with that in mind, I'm here today to commit to the residents of Grande Prairie and area that an Alberta NDP government will fund construction of both a replacement public school at Peace Wapiti Academy and a new Catholic kindergarten to grade 8 school in the Windsor area subdivision. When it comes to Peace Wapiti, the goal is to build a new junior high and senior high to meet the needs of a growing community. Fact is, the UCP has ignored this problem for 4 years, and now this year only just put forward a little dab of planning money. What I'm talking about is just moving forward and funding the actual construction of the replacement school. This is just the beginning of what you can come to expect from an Alberta NDP government. We will deliver better health care, better education, and a better future for you and your family. So thank you so much, and I'm very happy to take any questions folks here might have.
Just start with questions in the room. Everybody has questions in the room?
I have one. What might you have planned for EMS in the area?
Well, that's a really good point, and in fact, that's one of the things I was going to mention. We actually heard a lot about the EMS struggles that we're seeing here in the northwest part of the province. So we know EMS is in crisis all across the province. There's a number of different things we need to do to relieve that pressure, but 2 things that seem critical to me. First of all, we have to end this practice of the 89-day contracts for paramedics. We cannot expect folks to go into that line of work if that's how they treat it. So we basically have to renegotiate those contracts. We need to pay them in a competitive way to recruit more folks into that line of work. Secondly, we have to revisit the AHS reorganization of EMS services and its linkage with fire services and its community, its relationship to the community. Because we're seeing far too many instances of ambulances being pulled away hundreds of kilometers and leaving the communities that fund them without that service. So we want to sit down with municipal leaders, with healthcare stakeholders, with other community leaders to talk about how we can reconfigure ambulance services to make sure that we have a minimum number of ambulances staying in the communities that need them, while at the same time, efficiently getting ambulance services to where there's more demand. But we can't do that at the expense of communities that end up with no ambulance service. So we need to redesign and engage in consultation with how we restructure, but we need to also understand that we have a profound shortage arising from the fact that we are disrespecting the folks who are running those ambulances. And so the first step is to get an adequate number of ambulances, not just the cars, but the people inside the cars out there across the province.
Yeah. So Grande Prairie City Council has asked the local EMS here if they could utilize the fire departments more because they're being called out. The numbers have risen astronomically, and yet they're going to be the last to feel the effects of anything that comes out of Edmonton.
That's quite true. And so you're right. And so we actually had in a number of different rural areas around and regional areas around the province up until very recently, we had integrated services between fire and EMS, and we had cross-training and we had adequate resources and adequate management. And that was why when AHS first started this redesign, I think it started about 2012 to 2015, it created a lot of crisis because we had communities that had it working properly. And that's why we stopped that process in 2015, and in fact stopped it from happening in Calgary and Medicine Hat, a few other places, Red Deer. And then the UCP moved forward with that plan in 2019, further separating the integration between EMS and fire. What we need to do is because what's happening now is we've theoretically separated them, but then fire's not prepared to provide that backfill, or it's pulling them off of the work that they should be doing. But they could potentially work better together, but we need to bring the municipalities back to the table, bring the regional leaders back to the table, and reevaluate that configuration, because I think the plan initiated by AHS back in, again, as I said, 2012, 2013 was wrong. That's why we stopped it in 2015, and it should not have been restarted under the UCP.
We'll go to questions online. Reminder, please press the star 9 function if you're dialing in, or use the raise hand function on Zoom. Please state your name and outlet at the top. We'll go to our first caller. Michelle, your line is open.
Michelle Belfontaine from CBC. I hope you can hear me.
Sure can.
Okay, good. I'm on a different audio setup today. So Rachel, I wanted to ask you about the fact that you're in the north. I mean, it appears that you were in Slave Lake yesterday and you're in Grande Prairie today. Has the election campaign started? What are you up to right now?
Well, I'm going around and talking to folks all over the place. Yesterday, we had a seniors town hall at the Friendship Center, and that was really important. That's the work that opposition does, quite frankly, in between elections, regardless, hearing from folks on critical issues. But, as the election campaign started, I mean, certainly we know the UCP is spending about $9 million of taxpayer dollars right now to advertise to those taxpayers about things that look very much like election promises. So in that sense, I suppose it has, but of course officially it hasn't, which is the way in which they've been able to spend an utterly unprecedented amount of taxpayers' dollars campaigning to taxpayers. But listen, I say stay tuned. In a little while, you'll get to see our bus and our song, and then I guess maybe people will be really sure that the election started, even if it hasn't been called.
Do you have a
I know we do. I'm very excited.
Okay, I have another question for you, and I hope I can get a third. If I wanted to ask you also about, what do you think about the whole idea of campaigning though before a rate's dropped? I mean, she could drop the rate now, the premier could, but she isn't. So I mean, what do you make of that? Because everyone is sort of pretending that the campaign hasn't started, but it really has. So I mean, what are your thoughts on that?
Well, we have an election, a set election date, and so I think that we should stick to it. Alberta wouldn't be the first place where, understanding that there's a set election date, some people jump out the gate a little bit earlier than the E-28. That being said, though, the real problem that we have right now is that because we're not in the formal election period, Danielle Smith is spending millions and millions and millions of public dollars that belong to Alberta taxpayers, in order to advertise to them. And to me, that is incredibly bad behavior. I think it's disrespectful to voters, and it's disrespectful to Albertans. And so that is the part of this that I think should be overseen more rigorously. And I hope that Albertans will hold the Premier accountable for the fact that she's spending millions of their dollars campaigning to them.
And with that, we'll go to our next question. Next question goes to Safe Kaiser. Your line is open.
Thank you. Good morning. Ms. Notley, is it fair for you to say that about Danielle Smith when you were premier and going into an election, the NDP did the exact same thing, used taxpayer dollars to advertise on points that you believe you achieved when you were in government, and that is a fact.
So what I would say, actually, Safe, is that from the whole period of 2019, if you were to look at government communication spending, January, February, March 2019, you will find that there was very, very little spending that was dedicated to Albertans. And what Danielle Smith is doing is about 9 to 10 times as much or more than anything that we spent in the 6 months prior to that. So this is a profoundly more direct and considerable and overt use of public dollars to campaign to Albertans than anything that we've ever done. We didn't have a budget. We introduced a third quarter fiscal, and then we went on the election. We didn't spend millions and millions and millions of dollars advertising the budget, and we certainly didn't do mail out after mail out after mail out to Albertans' houses. And that's separate and apart, of course, from the election timed checks that are also going out the door. But it is a qualitative difference, Safe, between what was going on when we were in government and prior to the election and what's happening now.
Do you have a follow-up?
Well, I'll be honest, I don't have the exact numbers in front of me, Ms. Notley, but I would argue that if it doesn't matter if you're a little guilty or a lot guilty, if you're guilty of doing it, you're guilty of doing it. So it sounds a little bit hypocritical. I also want to ask you something unrelated. I'm not sure if you know, but the remaining 77 members of the Alberta legislature, including yourself, have been added to Russia's list of banned Canadians. So I want to get a follow-up to my question previous as well as that, if you don't mind.
Sure. So listen, I have never wavered on my view that Russia's illegal war in Ukraine is something that all people who believe in the rule of law must stand against. It is a tragedy what we see happening there, and obviously all Canadians stand with Ukraine, and so my view has been that from day one, and it has not ever changed.
And with that, we'll go to our next caller. Our next call goes to Dean Bennett.
Morning, Rachel. Hope you can hear me.
Sure can.
Okay, just before we start, I just want to put in a plug for my colleague, Michelle. She wanted a third question. I think she's back in the queue. So, helping each other out. So 2 questions. So first of all, you lay out, the Premier a couple of years ago in that policy paper laid out a pretty clear path to pay for, to have Albertans start paying for their healthcare, the doctors and co-pays, that sort of thing. But this week she said, look, that's not going to happen. You're not going to use your credit card. So what does it matter what you wrote 2 years ago?
Well, you know, this is a premier who from one week to the next week completely contradicts herself and says, oh, I misspoke about the things she said before. Albertans need to ask themselves, after the election, were she actually to be premier, would we not just hear that she'd misspoken when she promised that she wouldn't try to start privatizing healthcare? I mean, this is not a person who's demonstrated high levels of trustworthiness. However, what I will say, most importantly, Dean, is this, that I have been unwavering in my view that Albertans need healthcare when they need it, where they need it, regardless of how much money they have in their bank account. Danielle Smith simply cannot say the same. And Albertans need to ask themselves who they can trust. And I would argue that Danielle Smith's record makes her very untrustworthy on this critically important question.
Do you have a follow-up, Dean?
Thanks. Yeah, I just want to shift gears a bit. So the Premier has made clear this week she's not going to discuss the Pulaski call. But I'm wondering, regardless of that, aren't there some questions, or doesn't she, as Premier, need to answer, or do not Albertans deserve to hear answers to some of these outstanding questions, particularly why she is sort of agreeing with or saying she likes Pulaski's advocacy. She said that in a call, and now she says she denounces his extremism. I'm not quite sure what all that means. I mean, which part of his actions does she like or not like, and do we have a premier who thinks it's okay to, part of his thing has been to actually harass some of her own cabinet ministers, right, and Shamrow and Copping. I mean, is she okay with that? I mean, does she need to answer what she believes, what she agrees with on Pulaski, and if so, why does she need to explain it to Albertans?
I think she needs to come very clean with Albertans about the degree to which the extremist views advanced by Pulaski, as well as a number of the very extremist views advanced by her key support group, Take Back Alberta, the degree to which she also believes in those positions. Albertans deserve to know whether they are on the verge of selecting a premier whose views are deeply extreme and offside with the opinions of the vast majority of Albertans. And she has to stop slipping and sliding and ducking and diving and changing her story every day because, Albertans deserve better from someone who is seeking to lead the province. And quite honestly, a number of the views espoused by Art Pulaski, as well as many of the folks within Take Back Alberta who support him, who were critical to Danielle Smith becoming leader of the UCP, are very concerning. And she needs to speak openly to the in very clear detail what of his extremist views are not acceptable to her and which ones are. Of course, I would also like to make the point that it is unprecedented, really, that you've got a candidate for premier going into an election who is under the cloud of an ethics investigation, the outcome of which we very possibly will not see until after the election. I'm just not sure the last time we've seen something like that.
And Michelle, I'll turn it back over to you for one last question.
Hi, thank you, Rachel, and thank you, Dean. So Rachel, my one last question for you is with the nominations. I know I asked you about this last week, so you're up in Grande Prairie now. I know you've got the April 30th set for the Grande Prairie nomination. What's going on in Wapiti? Like, can you give me an update on that?
You bet. I think I can tell you with great certainty that the nomination date for Wapiti will be set no later than this Sunday. And we are confident that there will be at least one candidate putting their name forward.
And with that, we'll do one more pass for questions in the room.
Luke Andrews, CBC News. How long are you expecting to stay in the region?
Well, not too much longer. I've got a couple more meetings, and then we're heading out today. But you know, we're really excited with the number of folks that we did get to meet. We got to meet with education leaders, some municipal leaders, some healthcare folks that we were talking about, as well as just folks from the community, and so that was good. And I look forward to the next trip.
And with that, that concludes today's press conference. Thank you,
Thank you.
everyone.